Hi, everybody. Welcome back to my LinkedIn Lives. I'm Jasmine Navarro, certified wellbeing expert, working with educational institutions and companies, helping them support their family wellbeing challenges. And as you know, every week I interview different experts who make a difference. And today I'm very excited to be interviewing Carrie. Hi, Carrie.
Hi, Jasmine.
Thank you so much for coming on. Can you tell us a little bit about yourself and what you do?
Sure. Yes. So I'm Carrie. I have been working with
Mm.
kids, adolescents, adults who are experiencing difficulties with milestone delays, missing milestones, academic difficulties, challenging behaviors that we wouldn't kind of commonly associate with their particular age. Um, Anywhere from feeding problems to language difficulties, so no language or delayed language, um, working within the kind of scope of applied behavior analysis. So I've been doing that for over 20 years in the States and in Ireland. I've been in UAE for the past 10 years. So working within multidisciplinary teams, transdisciplinary teams, just helping the individuals and their families
Wow.
to thrive and overcome these difficulties. Yeah.
Okay, amazing, amazing. I'm super excited to be talking to you. Whereabouts in the States are you from, by the way?
I'm from Alabama.
Ah, okay,
Yeah,
cool.
so I still have I've been gone for a long time. I've been out of the States since 2006. So I was
Yes,
in Ireland for 8 years, and I've been here for almost 9 or 10 years. But I still have my accent. It's the kind of accent that you don't tend to lose.
yes.
Yeah.
Okay, brilliant. So you chose this title, which I've been getting a lot of response actually from this title because I think it's such an important topic. Kids behavior change with authenticity. Can you tell us what that means and why you chose it for today?
Yeah. So I've been kind of saying that a lot lately so I started Thriving Souls a little over 2 years ago, and we support kids in the home and in school overcome difficulties that they're facing, right? And so through behavior change, through applied behavior analysis, ABA, and we improve their behavior, we teach them skills. But it keeps coming to me, kind of giving individuals opportunities, but keeping with their authenticity, improving behavior, but keeping it with being authentic to oneself. And what this really means to me is we want to give somebody skills, right? We want to teach them social skills that they might be missing. We want to teach them language and conversation skills, but we want to keep things true to themselves. And we always want to know that at the end of the day, we want to give them skills should they choose to use those skills, right? So we're not forcing them or trying to change them inherently. We're just trying to give them opportunities, right? And keeping true to their strengths and things that they are naturally really good at, are naturally really like, throughout this behavior change. Because I work really closely with families, and most of the families that I've worked with throughout the years are amazing, and they get their kids and they understand it. I have had some
Mm.
first meetings with parents where their number one goal is to make their kids quote unquote normal or neurotypical or typical. And I always say to them, one, we don't want to do that because your kids
Yes,
are perfect. They're
yes,
amazing. They were born this way. They're perfect. And two, I cannot do that, right? I mean, there is no way I'm going to be able to change someone inherently, right? So I may be working with a 4-year-old child
mm,
with a diagnosis of autism, right? And
yeah,
we're going to teach them amazing skills. We're going to give them opportunities. And I hope, a few years into helping support them, they're able to play with their peers and
mm,
communicate and interact. But essentially,
yes,
when they are 16 years old, they are going to be the same core person. So you're going to
exactly.
see
Yeah,
in that
and
16-year-old, you're going to see that 3-year-old.
yeah, no, I think it's really important what you're saying as well because, well, you're saying, nobody needs to be fixed. Nobody's broken. Nobody needs to be fixed. And I think that's a really important point to make because,
Yeah.
and also you're being realistic as well. You don't have, I mean, nobody needs to be fixed, but even if somebody thought they did, you don't have a magic wand anyway. It's not like, because I've had that as well, where parents come to me and they say, we want to change this. It's like, well, that it doesn't work like that. So I think it's really important that you've made that distinction. So can you tell us a bit about what kind of parents come to you and with what challenges? I know you were saying a little bit about that, but yeah.
Yeah. So most of the families and the kids, the parents that I work with, they tend to be young, right? So like currently most of the kids that we're working with are anywhere from 19, 20 months,
Oh
you
wow,
know.
really young. Yeah.
Yeah, so I don't work with kids younger than 18 months because they're still developing and that sort of thing. And even then it's, I would first see them and see what's going on, first.
Yeah.
And then up until, there is no age limit, right? But the pool of
Okay.
kids is mostly between kind of 2 years and 6 years, right? I have
Oh
some
wow,
older
very young.
kids and I have some younger kids, but it's mostly kids who, are not responding to their name. So not so much eye contact anymore, but they're just not responding to their name. So when their name is called, they're not kind of looking or acknowledging that.
Okay.
Um, the language, there's usually some kind of delay in their language. So there's no words at all coming out, or, they're 4 and 5 and it's just kind of single words, right? So there's usually some kind of language concern. That's why, usually when parents come to me, um, or kind of a general lack of understanding, so
Okay.
with the parents kind of sitting down playing with the child, and they ask them to like get the ball, or, oh, give me the cup. There's no kind of understanding or recognition of that instruction. Simple little things, they might be playing with the ball and throwing it, and the child might throw it, and then the parent might say, oh, let's bring me the ball back, and they don't even acknowledge that. So the thought is that they don't understand either what the ball is, or they don't understand that instruction. And it's
Mm.
usually, even when parents will speak to pediatricians, it's not so much the expressive language that's a huge concern for that age. It's more the receptive understanding. If a
Okay.
child is understanding, things, and kind of point to objects, and, follows simple instructions, that's a really, really, really good sign, even if their
Yeah.
expressive language is not quite where it should be, because there's lots of time for that, right? I mean, language
Right.
varies hugely between 2 years and 4 or 5 years, right? Some 2-year olds are speaking in full sentences. Some are using only single words, and both of those things can be very typical,
Right.
right?
Okay.
So
Okay.
it's more the understanding. So I get a lot of that, and then, school plays a big factor. A lot of parents come to me when there are concerns from school specifically, right?
Right. Okay.
And so that might be with academics or learning, or their behavior in class, right? So um, not kind of playing or socializing or using language in class, or kind of able to kind of sit and take in the learning and that sort of thing. So all kinds of things kind of come up, but I would
Yeah.
say
Very.
language, you know, concerns from school, responding to
And,
their name, those are the big
mm,
things.
and I guess this is important to identify as soon as possible.
Ideally, I mean, yes,
Yeah.
of course. I mean, because the older we get, the more learned behavior comes into play. And it's not, I mean, when I first started out working with individuals, I worked with adults
You
who
do.
were, you know, over 22, with intellectual disability, autism, lots of challenging behaviors. And we taught them so many things, right? So it's definitely never too late to help someone and to build skills. Um, but it is much easier with a younger child, right? It's much easier for a lot of reasons, that learned
Mm.
behavior doesn't get in the way. And kind of when
Yeah.
a child hits 5 and up, you know, the skills that they learn, it's so rapid,
Is it?
academic skills
Yeah.
and language skills and social
Yes.
skills, just they learn so much, right? So between kind of 2 and 4 or 5, they're learning, but it's not as fast. A child hits 5 and they just, my kids come home and the, complexity of our conversations astounds me sometimes for a 6-year-old and their understanding of things, and they're just learning things every day. And so
Mm.
when a child has some delays or learns a little bit different, it just, it gets harder to catch them up,
And
and
how would
that's
sorry, how would a parent know? Well, of course they would know that something's just not right. But
yeah.
how would they know if it's just maybe, yeah, how would they?
Yeah, it is hard. I mean, like when I see little kids, right? So I see a 19-month-old or a 20-month-old, it is sometimes hard to know if it's just them and they're developing at their own
Yeah.
pace and we just need to be patient with them, or if it's something that warrants some intervention and support, right?
Mm.
And sometimes I know, right? So sometimes I can see a child and I know that it's more than just kind of a language delay, it's something more global,
Right.
like autism. Like, autism it tends to be multiple areas of
Okay.
difficulty, um, and so
Oh, really? So it's not just one.
yeah,
Yeah.
not just one, it's language skills and play skills and social skills, it's many different areas. I mean, it's a spectrum, so all kids are different, and whereas, of course, I don't diagnose kids,
Oh,
I've
that's what I was going to say. Do you diagnose them? Yeah.
I've done the AID so the 2 diagnostic or 2 of the main diagnostic, assessments for autism are the ADOS and the ADIR. There's multiple
Okay.
others, so, like, a psychologist or a developmental pediatrician would do more than those 2, but those are the 2 main ones, and I've done those trainings just so I get, a little bit more knowledge of it,
Yeah.
but I don't do the diagnoses, usually a child psychologist or a developmental pediatrician would, but I've seen enough kids and I know what the criteria is for it to kind of know, right? So when I
Mm.
see a child like that, I know we need to kind of intervene and support them. And if we don't, they're probably not going to catch up on their own. Of course
Right.
they will develop skills and they will mature because that's part of just growing
Human
up.
nature. Yeah.
Yeah. But it will not be at an, enough kind of speed to be at the level of their peers. There are some children that I see where I don't know. I don't really know the answer if we should just wait and be patient or if we should intervene and support. And I always stress to the parents that they really, really need to use their own parental intuition because we know as parents, especially the moms, we know when just something isn't right because they spend so much time with their kids. They know them, right? They know them quite well. And I saw this one little girl where that was the case. I said to the parents, I said, her play skills are age appropriate. Like, she's playing with toys appropriately. At this age, there's not a lot of interaction between kids. Like, you wouldn't expect that, right? So
Okay.
all the kids in the nursery are just kind of playing with their own things, parallel play. Um, there are some things like she had no language, but she seemed to understand things. Like, she knew her animals, and we could play and interact, and she seemed to understand things. But her mom said, "No, thank you, but something's not right. You're
Okay.
going to work with her." Right? And so support and intervention, when it's done correctly, when it's done, naturalistic and play-based, it it would never hurt anything, right? I
No,
mean, it's we're
exactly,
going
exactly.
to
So what happens then? So a parent would come to you and say, "I've noticed something maybe isn't quite right with my child." And then what
yeah.
would you do? Like, how would you so you would meet them, like, what would be the process, and then what would you do?
Yeah.
How would that work?
So I do like an intake assessment. So I have functional assessments that I would do. I do the Vineland adaptive behavior assessment. So that looks at it's a standardized assessment. And I know, like, we need to take standardized assessments with a bit of a grain of salt, right? They're not the be all and end all, but I think it sometimes helps parents to see where their child kind of falls. And it's all based on their
Okay.
their answers. So I would ask them some questions. Sometimes I just send it to them and have them fill it out. And it
But what
looks
what what if, oh, the parent fills everything out?
They might fill it out, or we would do like an interview. So I would spend a couple of hours with the child and the parents, either at home
Okay.
and or school,
Okay.
wherever there's big concern. So I would come into their home and spend some time with the child and or them, and maybe see them at school or nursery. And we would talk a lot. So I would ask the parents lots of questions, right? And I would do a few things with the child, like play with them and see where their skills are. And mainly I would be looking at, their receptive communication, expressive communication, social and play skills, depending on the age, right? For small kids, that would be about it, right? And
Yeah.
really, I just want to see, on average, where they fall in relation to peers around their same age, right? So, where do all these skills fall in relation to that? And then that gives us kind of an indication as to, do I recommend ABA support? And if I do, what do we work on? Like, what are the areas? What are the skills within those areas? And then also, how many hours in a week, right? And that depends on how many areas to work on, right? That
Sure.
we need to do. So
Well,
yeah, I mean,
okay.
it's
So yeah,
helpful for
it's a
people.
collaborative
Yeah,
um, part. So
yeah,
I guess because I work with older children and teenagers, so it's
okay,
obviously I do talk to the parents, but it's more about me and the child. But I guess with yours, because they're so much younger, you really need the
yeah,
parents' input as well.
yeah. Even for older kids. So I have I have a 14-year-old young person that I've worked with for 10 years since I've been
Yeah.
in
Oh,
Dubai.
okay.
He has the diagnosis of autism, but he has very, very good expressive language skills and very good receptive language. Like, all of his skills are
Mm,
kind of where they should be. Um, the issues are around kind of executive functioning skills and um, anxiety related things. That's kind
yeah.
of changed. He's evolved. He's definitely evolved throughout the years, into where his difficulties and strengths lie.
Mm,
But even with older kids, I would spend a lot of time talking to the schools and the parents, right? In addition to
sure.
spending a little bit of time with the child. Yeah.
So no, thanks. No, it's very interesting the work that you're doing. I think it's so important. So what would you say now then? I think I've kind of asked you this, but so if parents are maybe, they're with their children and they think there's something not quite right, is there something that the parents can do to know, or do they just need to contact somebody like
Well,
yourself?
there are screeners. I mean, it depends on, what they're concerned about. I do get a lot
Okay.
of parents of young children, and they tell me they're like, "I'm worried my child has autism," because there's a lot of talk about autism now. I mean,
Yes.
there is, a lot of adults are coming out saying they have a diagnosis of autism, so it's
Mm,
on people's radar. And there are
yeah.
screeners. There's online free screeners that parents can do. It's just questions that you would kind of answer about your child, and it would kind of give you a rating as to there could be a concern and there may not be a concern. A lot of
Mm,
parents would do a consultation with a developmental pediatrician, and it does, I would stress, it be a developmental pediatrician, right?
right.
There are lots of
What's the
pediatricians.
difference? Yeah.
They're trained in the diagnostics process of autism and things like that. And they're just,
Okay.
they look at things a little bit different. So a lot of times parents would go to a pediatrician, and if they're too young to be, assessed, they would say, just go and get some support, get ABA, speech and OT. Those are usually the three things that,
What are the
somebody.
three things?
ABA, what we do,
Oh,
speech
yes. Yeah.
language therapy, and occupational therapy. Those are usually the three, because those are research-based, evidence-based supports and therapies
Mm,
that do help support and help benefit kids of
exactly.
all difficulties.
Exactly. And as you said before, even if maybe their child hasn't got autism or something like that, then it's not doing them any harm anyway. So it's better to have that support, even if you don't need
Yes,
it, rather than not have any support at all. I
right.
guess you would know after a period of time, wouldn't you, that, okay, this is just not working. So it's better
Yeah.
to try. If in doubt, it's better to try.
It is, and we d I we I and the therapists that work with me, we do a lot of family support, right? So we spend a
Okay.
lot of parent time with parents, talking to them, showing them things, especially with the home sessions. The parents can join that, right? I do kind of monthly coaching sessions with parents should
Oh, do
they,
you?
want to do it. Just to, I mean, part of it, I try to be there for parents with where they are in their journey, right? So sometimes it's not training, sometimes they're not ready for that. It's just about supporting them and talking to them
Yeah,
um, about where they are, because it's a lot. It's a lot when your child has difficulties,
definitely.
um, and then eventually it would turn into, okay, how can you support your child at home? How do you work on responding to their name the way that we do? How do you work on getting them to answer questions the way that
Mm,
we do? Right? Because I have learned that the things that we do with the kids when we're working with them, it's just innate. It's just the way that we've been trained. It's easy for us. We know how to
sure.
prompt, we know how to get these skills out.
Yes,
But
automatically.
people, yeah, but people who are not in this field, they ask
Mm,
a child a question, they don't answer, they're like, "Well, I don't know how to get them to answer." Right? So it doesn't come naturally. So then I have to kind of spend some time with the parents on how to prompt, right? So what kinds of things to help, to do to help their child learn what to say,
yeah.
right? So, like, for example, we were, teaching a little girl that we work with. She had great language, or, she had expressive language. But if you asked her questions when we first started working with her, she didn't quite know how to answer. Even if you asked her her name and her age and where she goes to school, she just wouldn't answer, right? Now she can answer and she can ask questions back. So it's turning into
Wow.
like little conversations. So she can say her name and then she'll say, "What's your name?" Right? So she's learned all of that. But when her
Brilliant.
mom, asked her a question, she didn't answer. And I said, "So what did you do after that?" And her mom was like, "Nothing. I don't know what to do." Right? So then I had to kind of go through, you would ask, if you asked her, "Where do you go to school?" And there was just silence. You could give choices like, "Do you go to this school,
Mm,
or this school?" And then she could pick from one. And then you would say, "Oh,
mm,
that's right. So where do you go to school?" And sometimes you could use like textual prompts, if a child is reading. So you just kind of show that to them. You want it, prompts are kind of cues without giving them the direct answer, because you don't want to just tell them they repeat it. You want to help kind of get the wheels turning and help to get them to problem solve a little bit to figure out the answer. If they're wearing their uniform, you could say, "What's on your uniform?" And then they could look down and they remember, right? Um,
brilliant.
so it's little things like that that we help
Mm.
parents
So
kind
not
of do.
doing everything. You still want the child to do something. Yeah.
Yes, yeah, yeah. That's a big thing, It's easy to just give somebody the answer. It's kind of like when you're teaching a child math. Like, if you're teaching them, you could just give them the answer. But that's not what we do. We want to teach them how to figure it
Mm,
out, and that's the same thing with language.
mm,
I do a lot on kind of social media, and I think I talked about that one time about how to you know, teach a person to use problem solving skills to figure out language,
brilliant.
right? To figure out what to
Yeah.
say.
So really, I guess your work, it is a lot with the parents then, isn't it? Because it
Yeah.
really does make a difference how the parents are with the child.
Yeah. Yeah. I mean, we work with the kids, but it has to be hand in hand, right? We have to support the families. We have to, at least try to show them what we're doing, and so how they can, do some of it at home. Because, if these skills, it's not just for the 6 hours that we're seeing a child, it has to happen all the time, right? And
Exactly. And that's actually another question. So how, I know it depends on each child, depending on their needs and everything, but
yeah,
for example, like a coaching session with me would be like 1 hour, and I normally recommend at least 6 sessions. But I think with
okay.
you, how would it
Mhm.
work if parents wanted to work with you? I know it depends, but you just mentioned
Yeah,
6 hours. So is it quite longer?
yeah, it depends. So we work with kids in one session. It would be anywhere from like 1.5 hours up to 4 hours, right?
Is
So
that
with
one
little
child
kids,
or a
one
group?
child.
Right. Okay. Yeah.
Always, yeah, one child. With small children, I never recommend to do more than an hour and a half in one session, right?
Okay.
As kids get older and get more used to it, we could do kind of longer. We've got, some kids that we work with in 4-hour chunks, some it's in 3-hour chunks, some it's 2-hour chunks, right? And the number of kind of sessions per week, it does depend on the areas, right? So if it's receptive language, expressive language, play, social, lots of challenging behaviors. It's lots of kind of areas that I see that need work on
Yeah.
that would kind of increase the hours, right? Ideally, it's
Mm.
great to see, when we've got multiple areas that we need to work on, it's great to see a child every day, right? So
Oh,
maybe
really?
that's an
That
hour and
often?
a half. Yeah, maybe that's an hour and a half every day or 2 hours every day. When there's kind of just one or two areas that we need to work on and the other skills are kind of up to peer age appropriate level, then it could be kind of every other day. And sometimes with some kids where it's just kind of purely academic difficulties or some higher level social skill deficits. So they do have good social skills, but it's just some things that they're missing. Sometimes that might even be kind of 4 hours in a week.
Mm.
So it very much depends. And um, I am very conscious of to Dubai, you know, being a little bit expensive for all of these things. So I try to
Yes.
work with parents on this is my recommendation. And they say, but this is, we try to come to a happy medium where it's financially sustainable for parents. I stress that a lot to parents, right? It's got to be financially sustainable for them because this is not just we do it for a month or we do it for 2 months or 3 months.
No.
Like, longer term situation.
Okay.
Longer term in the sense of, it could be for some kids, it could be 6 months or a year. For some kids, it could be years, right? So
Right.
we need to come to something where they can, keep this going, but it's also effective. So so if a
Mm.
parent, if a family just really could only do kind of 2 hours in a week or 4 hours in a week, but this is a child where I know for a fact that they need kind of 10 or more hours in a week, then I would say to them, okay, let's use that 2 or 4 hours and just do parent training every week. So instead of actually having sessions with the child, because that probably we wouldn't really see any big results from it. We would just use that time to do parent training and train the parent to then work with the child. I've done that a
That
lot,
sounds
especially
good.
in remote areas. I actually did that in the States as well because there's a lot of remote areas in America as well. I mean, you could be, 2 hours from a
Sure.
place
Yes.
that provides these supports. But here, I've done a lot with families in Nigeria, even Lebanon and Oman, where we would actually train the parents, usually the mom or somebody that they have kind of found to do this, and we would train them to kind of run sessions with the child.
Wow, that sounds
So
super
there's always
interesting.
options, right? There's
There's
always
always
options.
options, and
Yeah.
something is always better than nothing.
Exactly. It is. It is. Something is always better than nothing, but you have to do what's going to be effective, right? So
Okay,
us
okay.
doing therapy 2 hours a week with a child who has lots of areas they need to work on, that's really not gonna do much for them. But
Oh,
training using that time to really train the parents and watch
okay,
the parent
okay.
do it with the child and then helping the parents, you
Mm,
know, devote to spending 2 hours a day doing this with their child, that would be
that
effective.
would so the best thing to do would be, do you offer, like, free consultations for, like, 10 minutes or something so parents can just have a chat with you first?
Yeah, I always do Zoom, kind of consultations, right? So whenever
Yes.
anybody is concerned about anything, I always do a Zoom chat just to see what's going on,
Okay.
um, you know, let them hear a little bit about me, see what's going on with them, and then we would see what we need to do after that.
So that's brilliant. So yeah, for anybody who's watching, if you do have any doubts or questions and you're worried about your child, definitely contact Carrie. Yeah, and just have a chat because you never know, do you? I think, and like you said, it can never be a bad thing to have support, even if you don't need it. It's better to try and not need it than miss out. But no, thank you so much, Carrie. It's been so interesting talking to you, and I've learned a lot actually. Can you is there anything else you would like to say before we go? And how can people find you?
Yeah, so I'm big on Instagram, so I'm on Instagram. It's at thriving souls underscore consulting. And on there, you can message me. I do lots of WhatsApps too, so I'm okay with anybody like somehow getting my number. It's not like if you go to my Instagram page, you can find all of my
Okay,
details on there.
amazing.
LinkedIn, all of that is there. We have a website, thrivingsouls.ae. So
Amazing.
find
Can you
me.
actually put all of those links on the post on the LinkedIn so people can just click?
Yes, I'll do that. Yeah.
That would be great. Thank you so much, Carrie. And thank you, everybody, for joining. It's been an absolute pleasure. And thank you, Carrie. And thank you, everyone. And I'll see you next week.
Thank you.